Hey guys, Dr. Duff here, and today we're going to talk about the most common causes of low back pain that I see in the office. So when it comes to low back pain, the way we look at that as chiropractors is we look at it from three different directions. The first one is going to be looking at the spine. Okay. The second one is going to be looking at the soft tissues around the spine, things like the muscles, the tendons, and the ligaments. And thirdly, we're going to look at the nervous system and the nerves that branch out of the low back, because a lot of times irritation of those nerves can cause pain and discomfort. So here in the office, we do an assessment to see what's happening with each part of that spine. So we'll assess your posture and we'll look for misalignments in the spine, which are known as subluxations. And these subluxations, or shifts in the spine, are going to represent either a weakened or damaged or injured area of the spine. And we can assess that by doing things like checking your motion, looking at your posture to see or identify any postural distortions. And then we're going to do different various orthopedic, neurological tests, and sometimes we can even take x-rays to get a closer look of the spine as well. Once we establish whether there are subluxations in the spine or not, then we can move on and see how that's affecting the muscles and the soft tissues and the ligaments around the spine. So a lot of times what we'll notice is our patients will say, "Doc, my left side of my back hurts, the right side, it's only my left glute or my right glute or my hip flexors." So when we look at the structure of the spine and we see how it affects those soft tissues, once we identify where those misalignments are, we can work on fixing those soft tissues, which can become their own problem as well. One of the effective therapies that we use to work on the soft tissue is using our adjusting instrument. It's a soft tissue massage type of device. We'll also utilize chiropractic adjustments, and then finally we'll also utilize either laser therapy or traction therapy, depending on what your needs are as a patient. So the adjustments are going to help restore and realign the spine in a better position. And what that's going to do is that's going to allow for the nervous system to get that communication and energy and reduce the irritation on those nerves so that the body functions better and heals better and feels better. Once we've taken that pressure off of the nerves, the symptoms are calmed down, then the body is really ready to fix the issues that are kind of the underlying problem. Whether it's a loss of curvature, whether it's a loss of motion at a joint, or it's just dysfunction of an entire region, that's what we're going to focus on and start correcting. Okay. Now, the last component are the discs and the soft tissues and even the structure of the spine. So in between each one of the vertebrae are these fibrocartilaginous discs, okay? And these discs, what they do is they help movement, they help absorb forces and disperse forces in the spine. And a lot of times what we see is our patients, sometimes they'll bend over to pick something up and the disc will tear or it'll bulge or it'll herniate. Or it can be a really damaging injury, like a really heavy deadlift or a car crash, that can cause the spine to shift out of its normal position or compress the joints. When those injuries occur, the spine can degenerate, where the discs start to swell, they can bulge out of the side and push into the nerves, and that causes irritation of these nerves and causes a decrease in function to wherever those nerves go. Sometimes it's muscles, sometimes it's things like these nerves can go to your lower digestive tract. They can go to your reproductive organs and your bladder and your kidney, all the way down to your toes. These nerves have branches everywhere. There's not a single cell, tissue, organ, or system of your body that these nerves do not connect to. And when they're irritated, health problems can arise because of that. So over time, these misalignments will create things like calcium deposits in the bone. If you've ever heard of bone spurs, kind of like on the back of a cowboy boot, those start to get created over the discs and prevent the movement from occurring, and it gets really stuck and it jams up, and it'll affect all the muscles to try and protect and compensate for these shifts and misalignments. So in fixing the spine, we prevent this from occurring, prevent that degeneration process from occurring, but also we can start to reverse that degeneration process and add years to the life of these joints and open up disc spaces so that they can become more hydrated, so that we can move better and have better function. The first step into identifying what's happening with the low back is consulting a doctor. What we do different here in the office, rather than medical doctors or surgeons or neurologists, is we'll take a full comprehensive look at the spine, the nervous system and the surrounding muscles, tendons, and ligaments to best help you identify what the root cause of these issues are so that we can go about fixing them and getting you back to a healthier life.